demonstrate a few of these passes, but when you do these particular movements, you want to go at least 10 passes or 10 reps across the muscle group. For those of you that are doing this for the first time, it is going to be sensitive. It is going to be a little painful for you. As you get more acclimated to the stress that the foam roller creates on your muscle, then you'll be able to adapt to it. So let me show you the first one that I typically do, kind of like doing it as a hover. Down on the forearms, starting with the foam roller just beyond the pelvis. On the quads, you can make a slight up and down action, maybe an inch or two, or for those of you that feel a little less discomfort, you can just do the full, complete roll, up and down from just above the kneecap to just below the pelvis, passing 10 times. From this position, we may decide to open the legs up nice and wide, turning the toes out away from the midline of the body. Again, inhaling and exhaling. There'll be a section just above the kneecap that is very, very tender, the vastus medialis. You can roll that foam roller, and particularly today after training legs this past weekend, this feels really special. So you want to get that vastus medialis or the teardrop on the inside of the knee. You can take this all the way up. You get 10 passes there. From this, we might decide to go all the way down into that pocket of flesh just at the top of the hip. You can get it into that pocket, take the foam roller, and you might deal with one side at a time, passing in and up and around that area. It's a small area, but if you are a runner, this area may be fully congested and need a whole lot more attention. The hip flexors for runners typically are very tight. We'll get this done on both sides. Then from here, we'll shift into the IT band. For most people, this is going to be the suggested starting point. You use the front leg as a braking system to relieve a little bit of tension, and then your forearm, again, you're going to lie on your side just at the hip and then travel down towards the knee. This again is 10 passes. You may decide to do just small sections at a time. Find the most difficult area. For someone who has a very high tolerance for pain or discomfort, you can just roll that whole IT band at one time and roll it until you feel a little reduction in pain. And we'll do that on both sides. The next step is to work on the inner thigh. The inner thigh, or your adductor muscle group, can be easily hit by straddling the foam roller this way so that it's lengthwise, and again moving it on the inside of the thigh all the way up to the groin, all the way down to the knee. Applying enough pressure there, you can crawl over, and again doing the same thing on that opposite side. This series can be done on the legs, possibly 2 to 3 times per week. At a minimum, at least once a week, we strive for at least 2 to 3 times. It takes you about 5 minutes to go through all of those lower body foam roller exercises. All right, the next part, after we've worked on the front of the thigh and the sides of the thigh and the inside portion of the thigh, we can work on the lower thigh and hamstring and calf area. So basically, what we want to do is one side at a time. Now, some people are going to be limited by their upper body strength and their ability to support their body. So the use of the foam roller may be just done sitting on your butt and rolling back and forth, looking for the sensitive spots. But the ideal combination is to come up and support your weight, and then rolling back and forth on the calf. By crisscrossing one foot, you'll be able to get a whole lot more tension on that calf. Go for the hot spot. I refer to it as a sharp bite. Find that spot, give it 10 passes, and then switch legs and go to the other side. You're going to find certain spots of the calf that's going to be really tender, so just spend a couple of minutes on that. Typically, the stretches that we use in one of the other videos will help loosen that area up. Use of the foam roller will help hit some of those hot spots a little bit more. The next step is your hamstring, going from your gluteal area, or what's called your ischial tuberosity. Basically, if I have someone start out sitting on the foam roller, it'll be like rolling back and forth, and you'll feel like what I call speed bumps You're going to feel as that hamstring inserts into the gluteal area and the main femur bone as it inserts into the pelvis. There's a whole lot of muscle tissue or flesh in there, and as you roll back and forth, you're going to feel that area. On that foam roller, you can just roll back and forth, get that area to soften up the tissue, rolling from one glute cheek to the other. The next step may be to give yourself a crisscross like this or a figure four, roll on to that side, and you'll feel that tension on the glute. And you can roll around on it and find the trigger points on the glutes so that you can work some of that tension out. Again, it's a 10-pass rule, and then you'll go over to the opposite side doing the same thing. So we'll hit those glutes, and then we may decide to get those hamstring muscles, and again, going back and forth on both sides. You can also increase the stress by positioning the body and then crossing the leg over the top of the other and rolling that hamstring. Very easy process to help loosen up those hamstrings.